Good evening, and welcome to our liver cancer community education event. We will get started in just a few minutes. Hello, everyone. As you are settling in, we would like to acknowledge Blue Fairy, the Adrian Wilson Liver Cancer Association, a nonprofit with a mission to prevent, treat, and cure primary liver cancer through research, education, and advocacy as our main sponsor. We also would like to thank the Delta Research and Education Foundation and also the CDC of Tampa, We Care of the University of South Florida, University Area CDC, and the City of Miami Community Partnership and Strategy Division of Human Services for their partnership in making this event possible. This community education event will be interactive. You will have the opportunity to participate in poll questions throughout. And our presenter will answer questions at the end of the event. But for now, we invite you to have your paper and pen ready. For it's an opportunity for you to take copious notes. The presentation will begin shortly.
Liver cancer is on the rise in our communities. Too many of our brothers and sisters don't know the risk. I had Hep C and diabetes, which both could lead to liver cancer. I no longer have Hep C. I'm alive, I am healthy, I'm thriving because I found out early enough to act. I want all of us in the Black community to feel empowered by the facts, to have a conversation with our doctors about the risk and about screening. Today is your day to ask questions, to understand that we can take actions against the risk of liver cancer and live a healthier life. Do it. Thank you for being here during Black History Month to find out about liver cancer and liver cancer risk. Thank you.
Good evening, and welcome to Love Your Liver Live, a Black History Month community event. Thank you for attending today to learn more about this very important topic and how it affects our community. Today, we have an expert with us, hepatologist Dr. Patricia Jones, here to discuss liver cancer, its risk factors, and what we can do to help ourselves and our loved ones. Throughout the presentation, there will be poll questions, and we ask everyone to participate as they appear on the screen. After the presentation, you will have an opportunity to ask her questions. Now, on the right-hand side of the screen, you should see a question and answer box. Or at the bottom of the screen in the right-hand corner, you should see a chat box. In both areas is where you can type your questions. And you can type your questions at any time during the presentation. Now, we won't ask those questions of Dr. Jones until the end of her presentation. And I'm going to apologize now. We may not get to all of your questions, but it's really important that you ask them because they're important to us and they're important to her. Now, there are a few rules we must follow as we ask these questions of Dr. Jones. This is an educational program, so please don't ask questions that are, specific to you in nature. They must be general in nature. We do not ask Dr. Jones questions that are personal. Let's reserve those questions to, questions that are personal between your health situation and that of your doctor. We cannot ask Dr. Jones questions that are, that would be perceived to be of a medical consultation. Let's reserve those for your next doctor visit. So without further ado, let's welcome Dr. Jones. Dr. Patricia Jones is a board-certified hepatologist specializing in transplant hepatology and gastroenterology. She is an associate professor in the Department of Medicine at the University of Miami's Division of Digestive Health and Liver Disease. Her research programs aims to better understand disparities in chronic liver disease, and the goal of her work is to improve the delivery of healthcare to populations disproportionately impacted by liver disease. All right, everyone, I told you all that we're going to have those poll questions coming, and it's time for all of you to put those fingers to work. Here's the first one. Black Americans are more likely than the general population to get liver cancer. How much more? Let me read that again. Black Americans are more likely than the general population to get liver cancer. How much more? A, 50%, B, 70%. Go ahead and answer this question for us. C, 100%, or D, 150%? What do you all think? Is it A, 50%, B, 75%, C, 100%, or D, 50%, 150%? Let's see, the answer is Black Americans are 1.5 times more likely to get liver cancer. Dr. Jones, I'll turn it over to you. Why is that?
Thank you, Tina. So today we're going to discuss why it is that Black Americans are more likely to develop liver cancer. We'll talk about what the liver is and how it works, how common liver cancer is. We'll talk about the risk factors for liver cancer, how people are diagnosed, and the treatments that are available, as well as some steps that you can take. So first, what is the liver? It's my favorite organ, obviously, but it's also the largest organ inside your body. It's in the top right part of your belly, and it does over 500 jobs for your body. It is the only organ inside of you that can regrow itself, and this is known as regeneration. Why is it important? Well, the liver is your body's filter. It removes toxins. It also helps to break down fats and cholesterol, and it breaks down carbohydrates or carbs and proteins. So how common is liver cancer, and why are we talking about it today? Liver cancer is on the rise in the United States. From 2000 to 2019, there's been an increase of 34% in people with liver cancer. Nearly 42,000 Americans are estimated to get a liver cancer diagnosis each year, and over 30,000 Americans are estimated to die from liver cancer. So liver cancer specifically in Black and African American people. We should know that hepatocellular carcinoma, also HCC, is the most common type of liver cancer. And the number of people in the Black community that are getting HCC is growing. As we just learned through the poll, liver cancer is 1.5 times more likely in Black American people compared to the general population. And not only that, Black Americans are less likely to be diagnosed with early stage liver cancer and have the highest risk of death. Education and taking control of your health can help you to manage your liver cancer risk. So again, we mentioned that there are different types of liver cancer. Primary liver cancer is cancer that begins in the liver. And in adults, the types of primary liver cancer include hepatocellular carcinoma, which accounts for more than 80% of primary liver cancers. There are other types that are less common, but we won't discuss those today. So the risk factors for liver cancer in Black and African American people, risk factors are a reason that someone is more likely to get disease than the average person. And some of the common risk factors include certain medical conditions, which we'll talk about, lifestyle choices, as well as ethnicity. Back to you, Tina.
Absolutely. So it's time for another poll question. Are you guys ready? Or is the audience ready to get those fingers going? Which of these are risk factors for liver cancer? A, hepatitis C, B, type 2 diabetes, C, being Black or African American, or D, all of the above? Let me read it again while you all begin to select your answers. Which of these are risk factors for liver cancer? A, hepatitis C, B, type 2 diabetes, C, being Black or African American, or D, all of the above? I see those responses rolling in. I'll give it 10 more seconds. Looks like the answer is D. Dr. Jones, tell us why.
Okay. So we'll talk about some of the liver cancer risk factors. Hepatitis B. So Black and African American people are 2.6 times more likely to die from hepatitis B compared to non-Hispanic white Americans. Hepatitis B can lead to a condition known as cirrhosis, which is when scar tissue replaces healthy liver cells. Cirrhosis increases your risk of liver cancer, but Hep B can actually develop into liver cancer or HCC without cirrhosis. So ask your doctor to screen you. It's a blood test for hepatitis B if you were never vaccinated or tested. Hepatitis C, as we heard in the video, is another risk factor. Hepatitis C infection is the leading risk factor for liver cancer in the United States, and Black or African American people are almost 2 times as likely to die from hepatitis C compared to white Americans. Hep C can be treated and cured, which may decrease your risk for developing liver cancer. Black patients with hepatitis C can develop HCC at earlier stages of liver disease. So if you have or have had Hep C, ask your doctor if you should be screened for HCC.
Looks like it's time for another poll question. What do you say, Dr. Jones?
Yep.
Okay, here we go. What do you all think? Black Americans are more likely than non-Hispanic individuals to die from Hep C. How much more? A, 10%, B, 43%, C, 88%, or D, 120%. Let me start the poll. Let me read the question again. Black Americans are more likely than non-Hispanic white individuals to die from Hep C. How much more? A, 10%, B, 43%, C, 88%, D, 120%. What do you all think? I see those responses rolling in. I'll give it about 10 more seconds. The answer is C. 88%. Black Americans are almost twice as likely to die from Hep C. Dr. Jones, please share more.
So we'll talk about some other risk factors. Type 2 diabetes is another risk factor, and Black Americans are 2 times as likely to get type 2 diabetes and have more complications. Type 2 diabetes is linked to increased risk of liver cancer.
We did say this was going to be interactive, didn't we, Dr. Jones?
We did.
All righty, let's get those fingers ready again. What do you think? Is type 2 diabetes an independent risk factor for getting liver cancer? A, yes. B, no. Let's see. Is type 2 diabetes an independent risk factor for getting liver cancer? A, yes. B, no. What do you think? Let's get those fingers moving. I see the responses coming in now. A, yes. B, no. We'll give it 5 more seconds this time. All righty, I'll go ahead and close the poll. The answer is yes. Type 2 diabetes has been shown to be a direct risk factor for liver cancer. Dr. Jones is going to share more.
So in addition to diabetes and hepatitis B and hepatitis C, which we've talked about, obesity is another risk factor. So obesity can lead to type 2 diabetes and NAFLD, which is non-alcoholic fatty liver disease or fatty liver, both of which are risk factors for liver cancer. So we should think about our body fat percentage and our body mass index, or BMI. And for men with a body fat percentage greater than 25% and women with a body fat percentage greater than 33% are at increased risk. For body mass index, or BMI, anybody with a BMI greater than 30 is considered a person who has obesity, and those with a BMI greater than 40 is considered a person with morbid obesity. If you don't know your body fat percentage or your body mass index, or BMI, see your doctor. So diet, what do we know about diet? A diet that's full of red meats and high fat size, such as those shown in the picture above, may increase your risk of becoming overweight, and that can lead to type 2 diabetes. Whereas a diet full of fruits, vegetables, whole grains, nuts, beans, and fish may actually help to reduce liver fat even if your weight stays the same. So eating a healthy diet is very important. Lifestyle choices. Certainly alcohol, it can increase the risk of developing liver disease and cirrhosis. Sharing needles, and we'll talk a little bit about that. And smoking, increase one's risk of developing liver disease and liver cancer.
All righty, before we go to this next poll questions, I know that the audience has some questions for Dr. Jones. Don't forget to add those questions into the chat or into the Q&A section because we do have time reserved at the end of her presentation for your questions. All right, so what do you think? Let's go ahead and get this poll started. Is being part of a certain ethnic group a risk factor for getting liver cancer? A, yes. B, no. Let me read it again. Is being a part of a certain ethnic group a risk factor for getting liver cancer? A, yes. B, no. We'll give it about 10 more seconds. All right, I'm going to go ahead and close the poll. The answer is A, yes. Certain ethnic groups have a much greater risk of getting HCC. Why is that, Dr. Jones?
We'll talk a little bit about it. Well, it has to do with the risk factors that we've talked about already, which are different in different communities. So we already talked about type 2 diabetes, and it's important that we know our risks and take actions. So if you have type 2 diabetes, it's important to get your blood sugar under control. It's important to find out if you do have type 2 diabetes. For hepatitis B infection, which we talked about having increased risk in the Black community, there isn't a cure, but actually there are great medications that can help you lower your risk for developing cirrhosis and liver cancer. We know that hepatitis C can lead to liver cancer at early stages, but it's curable and very treatable. We talked about the diet and obesity and how limiting red meat and high-fat dairy products as well as processed foods are better for our health, decrease our risk of developing obesity, and we should focus on a diet that has more fruits and vegetables. In terms of alcohol, alcohol works with all of these other risk factors and by itself is a risk factor for cirrhosis. No more than 1 drink a day is recommended for women or 2 for men. So it's important that we think about our alcohol consumption and limit it appropriately. So needle sharing doesn't have to mean using needles for the purpose of using drugs, although that is how sometimes needles are used. Also, people need to think about tattoos and body piercings. There are a lot of cosmetic tattoos that are done, such as microblading, for example. And it's important to know whether or not the equipment being used has been sterilized, because sometimes it has not. So that raises the risk for hepatitis C infection. If you smoke, it's important to talk to your doctor about resources that would help you quit smoking and understand what the risks are, specifically because you're a Black or African American person, and get tested appropriately. So work with your doctor to get tested and get the risk factors under control. So let's talk about how liver cancer is diagnosed. Typically, liver cancer is diagnosed using imaging tests, either an ultrasound, a CT scan, or an MRI. We also do blood tests when we're trying to examine a patient and understand what's going on with the patient with liver cancer. We'll look at the complete blood count, comprehensive metabolic panel, which will tell us all about things like the sugar, the sodium level. We'll look at the liver function panel. We'll do hepatitis testing, and we'll also do specific tumor tests because HCC, or liver cancer, has a protein that it produces, and that can help us to make the diagnosis. Sometimes biopsies are needed for liver cancer, but not all the time. And those biopsies may be taken using something called fine needle aspiration, which is using a needle, another type of biopsy. And this can be done surgically, which is called laparoscopy, and we can do some mutation testing of the tumors. So really important, a cure may be possible if liver cancer is detected early and removed by surgery. So talk to your doctor about being tested regularly if you have risk factors. How do we determine the stage of a person's liver cancer? Whenever a cancer is diagnosed, the doctors try to figure out how serious the disease is, and this is called staging. Staging is different for every cancer, but in liver cancer, it involves two factors. One, the tumor, and the other is how the liver is functioning. So we look at the tumor size and how many tumors there are, if the cancer has spread outside of the liver, and if it has spread, where has it spread within the body? We look at liver function and we use these classes to categorize people by their liver function. And someone who has normal function is class A. Someone who has mild abnormalities in their liver function would be called class B. And someone with severe abnormalities are called class C. And oftentimes this person is going to be too sick for surgery and many of the other treatments that are available. So that's why it's so important to be diagnosed early. So the three general stages are early stage, which is resectable or transplantable, and that means we can treat it by either removing the tumor with surgery or transplant and possibly cure the cancer. Intermediate stage is typically unresectable, and this is liver cancer that has not spread outside of the liver, but you can't remove it with surgery, and it's unlikely to be treated with a liver transplant, and that has to do a lot with the size. Advanced stage is liver cancer that is spread to the lymph nodes or other organs, and treatment with surgery is not likely because it's already spread beyond the liver, and so treatment with surgery is not likely to be effective. Back to you, Tina.
All righty, then it's time for another poll question. But before we get to that poll question, don't forget to put your questions for Dr. Jones in the chat area or in the Q&A area so we can get those lined up for her. So here we go for the poll question. I'll go ahead and get it started for us. What are some reasons liver cancer cannot be treated with surgery? I will read that again. What are some reasons liver cancer cannot be treated with surgery? A, cancer has spread throughout the liver. B, the tumor can't be removed because of where it is in the liver. C, patients are not healthy enough to have surgery. B, patients refuse surgery. Or E, all of the above. I'll read them again. A, cancer has spread throughout the liver. B, the tumor can't be removed because of where it is in the liver. C, patients are not healthy enough to have surgery. D, patients refuse surgery. Or E, all of the above. I'll give it about 5 more seconds because a lot of people were ahead of us on this one, Dr. Jones, with their responses.
Good.
I'll go ahead and close the poll. E, the vast majority, all of the above. Dr. Jones, please share with us why.
Exactly correct. So we'll talk about the treatment options that are available. As we mentioned, early stage disease is when it's confined to the liver and it can be usually treated with a surgery. And when liver cancer is caught early, there's a chance for cure. Local therapy is treatment focused on a specific area, and it's usually surgical if the patient can tolerate surgery. Surgery is used to try to remove all of the cancer, but transplant's a different type of surgery where the liver is removed and a donor's liver is put in place. So if you have advanced stage tumors, like we talked about before, that would be a reason surgery wouldn't be an option. Intermediate stage treatment options are non-surgical local therapy. And this is usually because there's too much tumor for you to remove it surgically and the patient still have normal function. So we don't want to cause harm to the patient by doing the surgery. And there are 3 main ways that we'll do this. Something called ablation, which is where you use extreme hot or cold radio waves, microwaves, and sometimes chemicals to try to kill cancer cells. Embolization is an interesting therapy where we take advantage of the blood flow going to the cancer and we inject substances into those blood vessels that goes directly to the tumor. And one of the benefits of that is it decreases some of the side effects people would get if the treatment was given everywhere because it's given directly at the tumor. Radiation therapy is using high energy radiation to try to kill cancer cells and to shrink tumors. So when liver cancer is in the intermediate stage, it usually can't be treated with a surgical option unless some of these things we've talked about works to get it smaller so that it's now an early stage, which sometimes happens. That's our goal.
Looks like it's time for another poll question, Dr. Jones. Let's see. There are no treatments for advanced liver cancer. A, true. B, false. Let me go ahead and start that poll. Is it going? Let's see. Did it do it? I don't know if it's doing it on that end. There are no treatments for advanced liver cancer. There we go. There are the responses. I see responses coming in now. Looks like we have more responses coming in now. I'm going to go ahead and close that poll. Let's see what the answer is. B, false. Although there are no curative treatments, there are many medications for advanced liver cancer. Dr. Jones, would you mind sharing more?
Yeah, I will. And this is really important because I think in the past, perhaps 20 years ago, there weren't, but now there are. So it's important to know that there are treatment options for people with advanced stage. So 80% of liver cancer is diagnosed at a stage that's too advanced for some of the local therapies that we mentioned. But developments continue in the treatment of advanced liver cancer. When cancer is advanced in multiple parts of the body, it's important that we use systemic therapy because this is treatment that will work throughout the body. And this will be chemotherapy, and that's drug therapy that upsets the life cycle of cancer cells, but also normal cells. Targeted therapy, which is therapy that focuses on certain parts of cancer cells to get in the way of how they grow, divide, and or move. And immunotherapy, which is a treatment that tries to make the immune system fight the cancer. If you've been diagnosed with liver cancer, don't lose hope. Even if you have been diagnosed with advanced liver cancer, there are approved treatments, so FDA-approved treatments and multiple treatments. It's really important that you find doctors that know about liver cancer and that specialize in liver cancer that can help you determine the best options for you. Doctors like oncologists, one who specifically focuses or specializes in HCC. Hepatologists like myself, and in some places there aren't hepatologists, but gastroenterologists are also involved in the care of patients with liver cancer. Self-care, we hear that word a lot, but it's so important when you've been diagnosed with liver cancer. So in addition to working with your liver cancer specialist, here are some of the actions that you can take. 1, manage your weight. Pay attention to your appetite and track your weight. It's really important that you don't lose weight. It's important that you stay a healthy weight so that your body can handle the medications and fighting the cancer. Track your energy so that you can work around when you're feeling tired instead of powering through. Eating a healthy diet is so important, making sure that it's balanced and that you're getting the nutrients you need. Drinking lots of water so that you stay hydrated. And I think very importantly, asking for help when you need it, because there are resources available to help you navigate the journey, but you have to let your doctor and team know what you need. Asking for help when you need it is critical to self-care. So let's recap. It's important to know your risk factor. And after today, I hope everyone will share what you've learned about your risk factors with your family and community. Make healthy choices. If you're someone living with obesity who has a poor diet or someone who has type 2 diabetes that's not as well managed, understanding how that can lead to liver cancer or other health problems and working with your healthcare team to change that. Taking action. Make an appointment to see your family doctor. Get your physical every year. If you have risk factors, find out if you have risk factors if you don't know, and see a doctor with experience treating liver cancer to be screened. Know your options. So even if you've been diagnosed with advanced liver cancer, you do have options, and a specialist can help you to figure out which course of treatment is best for you. Keep communicating with your doctor. It can be very overwhelming to have liver disease and to get a diagnosis of liver cancer, but it's important that you follow your doctor's treatment plan and keep notes so that you can discuss side effects or what's not working for you, because you're a very important person and part of the team. You can learn more about liver cancer at loveyourliver.us.
All righty. So here's a call to action, I believe, Dr. Jones. After this seminar, audience, wait a minute, before I go there, let me make one more call for action to put questions in the chat and then the question and answer. We do have quite a few that I see that have come through, but we do have some time. We reserve some time for questions. I mean, it's so important. We have Dr. Jones here. We want to make sure we have questions that she could answer for us this evening. So make sure to put those in the chat or in the Q&A section. But here's another call to action. After this seminar, what will you do? Will you make an appointment with your doctor? That's A. Will you get screened? That's B. Will you tell your friends about this information? That's C. Or will you do all of the above? Here's your call to action. After this seminar, will you A, make an appointment with your doctor? Will you B, get screened? Will you C, tell your friends about this information? And will you D, do all of the above? Now, we're not done yet. We still have more information to share. So just because I called for this call to action, I don't want you all to log off. There's still quite a bit more information to share. But we always have a call to action in the middle to make sure everyone's still present and paying attention. We have some good responses that's called in. So let's see where we landed, Dr. Jones. Looks like everyone is going to take a positive action for their health, family, and community. And why is that so important? Well, for Dr. Jones, I want you to answer that. Why is it so important that everyone does that? Why do they make an appointment, get screened, and take action at that point before we thank our sponsors? How about that?
So no problem. So it's so important because really, I think we say this all the time, but we are all we have, right? It's very, very important that we know our status. Sometimes people are afraid, but it's better to know and work with your team to take care of you. We all depend on each other. So, as some song says, I need you to survive. So we need everybody to know their status, to get the treatment that they need, to do the best they can taking care of them before they can help others, because certainly you're the priority.
Thank you so much, Dr. Jones. Now, I know those questions are coming in. I am seeing them coming in. But before we get to those questions, we just want to thank again our sponsors, AstraZeneca, Exelixis, ASI, and Merck for their support of this event tonight. So as these questions are coming in, I want to make sure that we are following some of the rules that I mentioned, and thank Dr. Jones for this amazing information. We know it was a lot of information that was shared this evening, but we want to invite you to visit Love Your Liver US to learn more. Now, let me spell that for you because I know Love Your Liver. I want to make sure I spell it out for you. LOVYOURLIVER.US. Or you can just pull out your phone if you're at your computer and scan that QR code that you see there on your screen. Now, we're going to start with the Q&A session in just a moment, but please remember a few of the guidelines that I shared in the beginning. Dr. Jones cannot answer questions about your specific health condition or provide medical advice. Please do not disclose any of your personal health information, as such questions should only be directed to your own doctor. And remember, Dr. Jones, if she is your personal doctor, reserve that for your next office visit. And again, we apologize in advance if we cannot get to your question. But Dr. Jones, we are ready to begin with questions. Are you?
I am.
Okay, so what are some liver cancer symptoms?
That's a great question. And for the most part, liver cancer is silent until it's very advanced. So the liver itself doesn't have pain fibers. So persons can have a mass and they won't necessarily be aware of it. Some of the signs of a liver cancer would be liver tests that are abnormal. So if you're going to your doctor regularly and you're getting your blood work regularly, your doctor might notice that your blood tests are a little different than they used to be. And that's one of the signs. When liver cancer becomes more advanced and it's large, it can then cause some symptoms. And some people will have pain in the upper part of their abdomen. That's probably the most common symptom that lead people to get diagnosed. If it's very, very advanced, the liver won't work well. And sometimes people may turn yellow because they're not able to process some of the proteins and the toxins that we talked about earlier on. So generally, it's silent and it's picked up because someone's paying attention to someone who has risk factors, either with blood work or imaging. And we don't want people to present when they have symptoms, meaning it's so advanced that they're now having pain. But that can be sometimes how people present.
Thank you so much, Dr. Jones. Now, if I have an elevated or a higher BMI, am I at risk for developing liver cancer?
Yeah, yes, you are. So as we mentioned, having obesity, living with obesity is one of the risk factors for liver cancer, and not just liver cancer, I'll add, so other cancers as well. So maintaining a healthy weight is very, very important. And understanding your body fat percentage is important as well, because we know that there are some people that sort of have a different body definition. And so the body mass index doesn't tell us everything about a person. Some people are more muscular, I should say, I'm sorry. But understanding what your body mass index is and what you can do to get it within a normal range is very important, because yes, obesity does increase the risk of developing liver cancer.
Okay. Now, if I've been cured of Hep C, am I still at risk for developing liver cancer?
Potentially you are. So hepatitis C can lead to cirrhosis, and that's when there's the scarring and it's replacing the normal cells. It really depends where in that pathway you are at the time when your hepatitis C is cured. So if you have developed cirrhosis and your hepatitis C is cured, you are still at risk to develop liver cancer, because cirrhosis really is the strongest risk factor. There are other people that don't have cirrhosis, and it's much more rare or much less common for them to develop liver cancer. But let's say someone who's sort of pre-cirrhosis or in the earlier stages of having some scarring, but not quite cirrhosis, those people should still be followed until their specialist tells them they no longer need to be followed. The improvement in your liver, once you're cured with hepatitis C, can take some time. So it may take several years before all of the scarring kind of reverses. And it's important that you stay under the care of your specialist that treated your hepatitis during that time, so that we can find cases early should they occur.
Now, Dr. Jones, you mentioned that African Americans are at a higher risk for liver cancer. Is it hereditary or genetic to some degree?
That's also a great question. And the answer is we don't know the answer to that question. So one of the things that we're really interested in understanding when we think about why it is that Black people are at increased risk of developing liver cancer is to understand how much of this is related to genetic differences. Certainly not every Black person with hepatitis is going to develop cancer, so only certain people do. And what does genetics tell us about who is at highest risk? So that's actually something I'm working on myself to try to better understand how genetics play a role. Certainly, risk factors sometimes run in family, and that might be why we see some risk factors of having liver cancer in more than one person in a family, but we don't know enough about genetics. And the other thing I'll add is that some of the studies, or many of the studies that have been done to understand the genetics of liver cancer, have not included a large number of African Americans. So we can't answer the question because we don't even have the samples to know. So that's why that's such an important question that we want to answer, and we're working towards answering it. Great question.
Now, do doctors automatically screen for liver disease during like our annual physicals or checkups, or do we have to ask our doctors to be screened, to have a liver screening or liver cancer screening during our annual physicals?
So let's break it up into two because there's screening for liver disease and there's screening for liver cancer. So screening for liver disease, absolutely, doctors should be screening. All adults should be getting their labs done at least yearly to look and see whether or not their liver tests are abnormal, along with other tests. Hepatitis C should be tested at least once in every adult. And hepatitis B really depends on risk factors. And many Black Americans actually do have risk factors for hepatitis B, depending on where they're born and other risk factors. So they also should be screened. I think it's a very good idea to ask your doctor what your status is, because our primary doctors and our family doctors are doing a lot. They're trying to manage diabetes and high blood pressure and all sorts of other things. And sometimes the screening for hepatitis doesn't get done. So it's always helpful if a patient says, hey, what's my status, doc? Do I have hep C? Have you tested me? If you don't know. So that's the screening. Certainly it's recommended, but whether or not it's getting done, it's up to you to ask your doctor and be aware of the labs that are being ordered and the results. Are they normal or are they not normal? Now, in terms of screening for liver cancer, people with risk factors for liver cancer, the ones that we've talked about, hepatitis B, hepatitis C, those who have cirrhosis, those should be screened in a program. And usually that person is involved in care with a specialist who will be screening them every 6 months using some sort of imaging. So it's not everyone in the whole population or everyone who has a BMI of 30. No, it's certain people who've been determined to have higher risk for liver cancer that should be screened. And they should talk to their doctor about whether or not they fall in that category. Do I have cirrhosis? Do I have any scarring in my liver? And that's how they would know whether or not they should be screened.
Thank you so much, Dr. Jones. Now let's talk about type 2 diabetes because that is very prevalent in our community. And could you relate again or reiterate to us the link between type 2 diabetes, the risk of it, and liver cancer?
Very good. So type 2 diabetes is very prevalent, as you mentioned. Obesity is also very prevalent in our community. And together, those increase the risk of non-alcoholic fatty liver disease, which is fatty liver, which is actually quickly becoming one of the highest or strongest causes of liver cancer in the United States. But by itself, diabetes can increase cancer risk. Again, not to the point that just because you have diabetes means you need to be screened, but certainly you have diabetes might mean that you have higher risk of having cirrhosis, which is the risk factor. So it's not just having diabetes, but also poorly controlled diabetes. So there's some markers of how well your sugars are controlled. If you have diabetes, you should be checking your blood sugar. You should be talking to your specialist or your primary doctor about your sugar and whether or not you're well controlled, whether or not additional medications are needed to get you under control, because having poorly controlled diabetes is a risk factor, not only for liver cancer, but many other health outcomes.
Absolutely, doctor. Now, if we go back to what you were saying about fatty disease, now is fatty liver disease genetic or is it solely from poor eating habits or high cholesterol?
That's another great question. And it's both. It's both. So there are some tests, and this isn't done commercially, but research has been done to try to understand why certain populations have a higher risk of fatty liver compared to others. Actually, the group with the highest risk of fatty liver are Hispanic Americans or Hispanics in general. And so there actually have been some genetic tests to examine why, and we have found some changes that tell us why they're at higher risk to have fatty liver and also to have progression, meaning they don't just have fatty liver, but they're more likely to have inflammation and scarring or cirrhosis. So again, like I mentioned before, there are few studies that include African Americans, so that it's really difficult for us to understand the genetic contribution in fatty liver disease. The other thing I also tell my patients is that diets run in families too. So most people eat the same thing that their parents ate and their parents ate and their parents ate. Every once in a while, you have someone who, does a complete, 180 from what their parents ate. But for the most part, we tend to eat the foods that we grew up eating. So people who have a certain diet or people who are overweight tend to be in the same family. They're clustered together. So that might be why we see this in fatty liver disease. It's partly because of lifestyle and culture. Our culture is so important. And so it might be because of that. But genetics definitely play a role in fatty liver. And we're interested in learning more about specifically fatty liver and Black Americans.
Let's stick to the point about diet, right? And in that vein. So let's go to the opposite direction. Let's say, could eating a high protein diet, like for working out or building muscle, affect liver test results? And if you have, let's say, an abnormal result, is it always at liver cancer risk? Are you at risk for liver cancer because you have a high protein diet because you want to build muscle or working out and that thing?
That's a great point and astute observation. So some people will have elevated liver enzymes and they should be seen. So this is not something that we should assume, oh, well, my enzymes are just elevated because I worked out. But yes, in fact, extreme exercise, and I'm not talking about the typical, even daily exercising, shouldn't cause this. I'm talking about someone that sort of does extreme exercise, perhaps several hours a day, lifting heavy weights, lots of heavy training. So you may see this in athletes, for example. Then the enzymes can be elevated and it might be attributed to that as opposed to a liver disease. But whenever someone's liver enzymes are elevated, that is, liver disease is the diagnosis until it is excluded by doing other tests. So yes, certainly if someone is run a marathon and gets blood work the next day, their enzymes might be elevated and it might not be because of liver disease, but we should never assume that. We should always look to see why or why not, whether or not they get better on the next check when the person is not exercising, for example. Can I also just add a little, and you didn't mention this, or the question didn't, but one thing that I think goes along with exercise is supplements. So there are a lot of people who use supplements when they exercise. Some are like pre-workout or creatine. And there are some that are absolutely safe for people to take before they work out or during their workout. And then there are others that we actually know can cause injury to the liver. So it is related to working out. And I think it's something that we should all be in communication with our doctors to understand whether or not the supplements we elect to take are going to increase our risk of any injury to the liver. And if it's safe, then fine, by all means. But there are actually a lot of supplements. That's the number 2 cause of drug-induced liver injury in the United States is supplements that are for, dietary supplements, for example. So really important when we think about working out, we think about supplements, and those can increase the risk of liver injury.
Thank you so much, Dr. Jones. Now, how do I know if I have a fatty liver? Are there any tests that can be taken that will denote it, that will put me on the right track to know that I need to be tested for liver cancer?
Mm-hmm. So the 2 things, one, again, the doctor that you're seeing or the healthcare provider that you're seeing should be at least annually checking your labs. If your labs are abnormal, they should investigate why your labs are abnormal, and they will do an ultrasound. Usually that's the first thing that someone will do. Is non-invasive. It just looks at the liver, sometimes looks at other organs, and it can tell you whether or not the liver is fatty. Now, there are certain people that we know are increased risk of having fatty liver, and that would be someone who is obese or overweight, somebody who has diabetes. So even those people, if their enzymes are normal, it is actually reasonable to screen for fatty liver using ultrasound. And the reason is because those people may have normal enzymes, but they may actually have fatty liver and they may actually have some inflammation that's going to lead to scarring. So people with certain metabolic risk factors like diabetes, obesity, high cholesterol, those are all people that should likely get screened for fatty liver, because again, you're not going to feel anything. You're not going to feel any type of way because your liver is fatty. So it's important to use this objective information, labs, ultrasound, and whether or not your other medical conditions are risk factors.
Now, just a couple more questions, Dr. Jones. Are there any early warning signs of liver cancer? You know, we as a community, we tend to overlook some of the early signs just because we're so busy being superwoman and supermen for everyone else, along the lines of self-care that you were talking about early on in your presentation. But are there any early warning signs that we really need to take notice of?
Really, unfortunately, not. These labs that I mentioned, any discomfort, I think I'd say, and this goes for any part of our bodies, when you talk about being Superman and Superwoman and ignoring things, we're not meant to feel discomfort, right? That we can't explain. So if you have discomfort in the right side or pain, that's not something to ignore. That's something to try to understand, why is it happening? It's one thing, okay, I've had an injury, I had a car accident, and I have this back pain, and that's why. Well, then you know why. But if you develop symptoms, pain in your right side, swelling in your abdomen, swelling in your legs, that's not normal. And you should understand why. So I think more importantly, we shouldn't ignore subtle signs that something's not right. But the liver itself is not going to necessarily flash a warning sign. So any discomfort, especially if it's present and it's persistent, is something that you don't want to ignore. You want to talk to your doctor about the fact that you have discomfort, and they'll usually get an ultrasound and see whether or not there's anything of concern. The gallbladder is also in that same area. And so it's important to look at that. So that was something that any doctor can order if you have discomfort.
Two more questions, Dr. Jones. If I think I have risk factors and my doctor doesn't offer any type of screening for liver cancer, may I ask for it?
Absolutely. We are our own best advocates. So if your doctor is not ordering it, you should ask for it. Absolutely. You are the captain of the team. That's why I always tell my patients, you're the captain. So you should be asking for things. Now, maybe there's a reason. Maybe they did it last year and they know the result. But by asking for it, you can have that dialogue with them, and they can say, no, you don't need it because you already had it. But please advocate for yourself and ask for the screening test so that it gets done and you know your status. That's very important.
Absolutely. We must take charge, as you said. We are captains of our team. And then finally, Dr. Jones, final question for this evening. If we do, or if our loved one has liver cancer, is there hope?
Absolutely. There is hope. And I think the worst thing to do is to lose hope. It's normal to worry and to wonder. But when we become hopeless, we stop moving. And certainly there is hope. There are treatments available, but we certainly don't have 3 months to wait before we treat. So it's important that you process those emotions and get the help that you need, because every center will have resources, be it a social worker, be it a counselor, psychologist even. There are things that can help us to process as we move through this journey. And it's not just important for patients, it's also important for caregivers. So by all means, please take care of those emotions, but try to move forward at the same time and don't lose hope. The treatment landscape has changed so much since 2011, 2017. We have new treatments available and really better survival than in the past. So it is important that we not lose hope.
Thank you so much, Dr. Jones. And thank you to each and every one of you for taking time out of your day to learn more about liver cancer and what you can do and we can do for ourselves and for our loved ones. Please prioritize your liver health and go see your doctor for your regular checkup. Talk to your doctor about your risk factors. Be the captain, as Dr. Jones has said, for your health and for the health of your loved ones. And believe that there is hope for you to have a healthy liver. Remember, for more information, to visit loveyourliver.us. And I'm going to spell that for you again. That's LOVEYOURLIVER.us, or you see it there on the screen. We'll have it up there for a few minutes so you can use your cameras to take that QR code to learn more about it. We thank you again for joining us. We thank our sponsors. We thank our partners for this evening. Have an amazing evening and good night.